Hi there, and welcome to A&P with Dr. O. In this video, we are going to focus in on the systemic arteries and veins of the upper limb. And we're going to go ahead and start with our subclavian arteries and veins. I know we've already briefly talked about those, but they're going to give us a good starting point for us to then trace down into the upper limb here. Again, I'll kind of encircle these right here. So these are going to be our subclavian artery and vein. The artery is going to be on top. The vein is going to be on the bottom. And then as we follow those, and as they reach the armpit area here, that area is referred to as axillary. This then is where we're going to have our axillary artery and vein. Again, on top with our oxygenated blood in red is the artery, and then underneath with our deoxygenated blood in blue is our vein. Since we are in the systemic circuit, we have oxygenated blood in the arteries, deoxygenated blood in the veins. Remember, in the pulmonary circuit, that is reversed. If we go ahead and continue on with our artery, if we follow the axillary artery, now we are in the brachial area. And that means then that this is going to be our brachial artery. We can also see the brachial artery on this other model as well. And then we can see this very small branch of the brachial vein. Again, brachial artery and then brachial vein. We would have the same thing over here as well. So once we get into this brachial region, then we have that brachial artery. If we go into the forearm, we have a vessel that runs along the radius and one along the ulna. If we're along the radius, that means that we have the radial artery. There would be a radial vein here as well, even though it's not shown. And then on the ulnar side, just kind of loop around here with my arrow, we have our ulnar artery, and same thing. We would also pair that with an ulnar vein, even though it's not shown. If we go back to following our veins, we can start again with subclavian on either side here. And then when it moves into that armpit region, then we have axillary. And then you can see that there's a split, and you can see it on this side as well. And we can see that one is going to go on the outside, and then one is going to stay on the inside. The one that stays on the outside is known as the cephalic vein, because cephalic means outer. And then the one on the inside is going to be the basilic vein, and basilic means inner. And we can see the same thing over here. We would have a cephalic vein on the outer, basilic on the inner. And we can see that it starts up top and it goes all the way down. So all the way down on the outer portion of the arm. Same thing with basilic. It goes all the way down on the inner portion of the arm. It may be helpful then to, have the line be here and then also extend it down to here, just so that we know that this entire one is basilic. And we could do the same thing with our cephalic. We could make sure that we know that it's going to go all the way down on the outer portion of the arm. And then we have this vessel here that goes across the front of the elbow. That landmark is antecubital. And that's going to help us remember that this then is the median, because it goes across the middle. Cubital goes across the middle of the antecubital area. And then, of course, this is going to be one of our systemic veins.